Hey, welcome! Today, we are diving deep inside one of the most incredible and honestly misunderstood joints in your body, the knee. We're going to pull back the curtain on the secret mechanics that lets you walk, run, and jump literally every single day.
Bending your knee seems so simple, right? It's something you do thousands of times a day without even thinking about it. But have you ever stopped to wonder what's really going on in there? Because it's not just a simple hinge. Oh no. It's this fascinating mechanical dance, and we're about to break it all down.
So to really get what's going on, you have to realize that the knee speaks two completely different languages. One is the obvious one we all see, and the other is a hidden language that makes everything else work.
Okay, so on one hand, you have osteokinematics. Just think of this as the big picture. It's the large, sweeping motion of your bones that you can see, like your lower leg swinging forward. But then, on the other hand, there's arthrokinematics, and that is the secret language. These are the tiny, super precise rolls and glides happening between the actual surfaces of the joint. And here's the kicker. You absolutely cannot have the big picture movement without these secret little ones.
So how in the world do we crack the code of this secret language? Well, it turns out it all boils down to one single, elegant rule that controls how any two curved joint surfaces talk to each other.
This right here, this is our Rosetta Stone. It's the key to everything. Here's the deal. When a concave or kind of scooped out surface moves on a fixed convex or rounded surface, the roll and the glide happen in the exact same direction. But if you flip it and the convex surface moves on a fixed concave one, the roll and glide have to happen in opposite directions. Why? To keep the bone from popping right out of the joint. This one rule explains it all.
All right, theory's cool, but let's put this rule into practice. We're going to start with a really simple movement, just straightening your leg, or what we call knee extension.
First up, let's look at something called an open chain movement. All that means is your foot isn't planted on the ground. Think about sitting on a chair and kicking your leg out, or, kicking a soccer ball.
And boom, here's our rule in action. Your tibia, that's your lower leg bone, has a concave top surface. It's moving on your femur, which is convex. So, as your tibia rolls forward to straighten the leg, it also has to glide forward. Roll and glide, same direction. Simple as that.
Okay, but what stops your lower leg from just sliding right off the front of your thigh bone when you kick? That's where a guardian comes in, your ACL, the anterior cruciate ligament. It pulls tight and basically acts like a brake, stopping that forward glide from going too far.
Okay, time to flip the script. What about a closed chain movement? This is when your foot is planted firmly on the ground, like when you're pushing up to stand from a squat.
Now everything is reversed. Your convex femur is the bone that's moving, and it's rolling on your fixed, concave tibia. So, to stand up, your femur has to roll forward. But think about it. If it only rolled forward, it would roll right off the front of your knee. So to stay centered, it has to glide backward at the exact same time. The roll is forward, the glide is backward. Opposite directions. So who's the guardian this time around? It's the PCL, the posterior cruciate ligament. As that femur rolls forward, the PCL tightens up and actually helps pull it back, enhancing that crucial backward glide to keep everything perfectly aligned.
Nice! We've totally nailed extension. So let's apply the exact same logic to flexion, which is just the act of bending your knee. It's the same rule. We're just hitting the rewind button.
Let's start with an open chain example. Just picture yourself at the gym on a hamstring curl machine. You're pulling your heel in towards you. Your foot's just swinging free. Here we go again. Concave tibia moving on the convex femur. To bend your knee, the tibia rolls backward, which means, you guessed it, it also has to glide backward. Same direction. And this time, it's the PCL that steps in as the guardian, getting tight to make sure the tibia doesn't slide too far off the back. All right, for our last scenario, let's look at closed chain flexion. This is just the simple motion of lowering yourself down into a squat with your feet flat on the floor.
So as you squat down, your convex femur rolls backward on your fixed tibia. And according to our golden rule, to stay in the joint, it must glide forward at the same time. And our guardian here? We're back to the ACL. The ACL gets tight and acts like a tether, helping to pull the femur forward and enhance that glide, keeping it from rolling right off the back. So, we've met our two main bodyguards, the ACL and the PCL. Let's pull this all together now and look at how their jobs totally shift depending on what you're doing.
This table right here, this is the big aha moment. Look at the pattern. In open chain movements, where your lower leg is moving, the ligaments act like brakes. They prevent too much glide. But in closed chain movements, where your thigh bone is moving, they act like guides. They enhance the glide that's needed. It's this incredible complementary dance of protection and control.
But hold on, the ligaments aren't doing all this work by themselves. There's another key player in the game, a real unsung hero, that helps make all this gliding happen so smoothly.
Meet the meniscus. You've probably heard of it. These C-shaped bits of cartilage are basically like smart wedges. As your femur rolls, it's kind of rolling uphill on the meniscus, and that wedge shape naturally helps guide the femur to glide in the correct direction, giving our ligament guardians a big helping hand.
You know, if you're going to remember one single thing from all of this, let it be this principle right here. In open chain movements, your big cruciate ligaments act as bricks. They prevent glide. In closed chain movements, they act as guides. They enhance glide. They prevent and they enhance. It's that simple. Always working to keep your knee rock solid.
So now you know. You can decode the secret language of your knees. You understand the hidden dance of rolls and glides and the guardian ligaments that protect you every single moment. So the next time you take a step or jump or even just stand up from a chair, maybe you'll think about that amazing silent conversation happening deep inside your joints.